So today we are talking about the surgical infection. The infections means a local and systemic inflammatory response caused by invasion of pathogens into body and their reproduction in the body. It can be systemic infection. That means the serious systemic infective or toxic symptoms resulted from invasion of pathogenic organisms into blood circulation and reproduction or producing toxin in the body. Generally, it indicates sepsis and bacteremia. And today we are focused on the surgical infection. The surgical infection means the infections that require operative treatment or result from operative treatment. The history of the first is listed in 1867. He's a British doctor. First proposed the concept of antibacterial surgery, becomes the founder of antimicrobial surgical. In 1886, the German doctor Bergmann introduced the principle of steam sterilization and make sterilized technique so that the surgical infection rate decreased significantly and the surgical techniques have developed rapidly. Fleming discovered penicillin in 1929. It is the milestone of prevention in surgical infection. Before the advent of antibiotics, surgical infections was mainly caused by Streptococcus and Staphylococcus aureus. The invention of penicillin helped to control these two pathogens. Application of antiseptic practice allowed the infection rate of operation to drop from 90% to 10%. So the antibiotics induced in middle of 20th century, the people hope the serious surgical infection may eliminate it, but actually this did not occur. At the present time, a lot of nosocomial infections happened, and the antibiotic therapy was widely used. And the new techniques such as endoprothesis, the transplantation require immunosuppression agent, etc., that all will cause the increased rate of the infection. Now we come to the SIRS. What means SIRS is called systemic inflammatory response syndrome. It means the serious invasion caused the massive release of inflammatory mediators in the body, caused by systemic reaction followed two or more clinical performance. There was four different. One is body temperature more than 38 centigrade or less than 36 centigrade. The heart rate more than 90 beats per minute. The breathing rate more than 20 beats per minute, or the artery carbon oxygen 2 less than 32 mmHg. The white blood culture more than 12,000 per milliliter or less than 4,000 per milliliter. There's a lot of inflammatory mediators. One is a cytokine, including TNF-alpha, interleukin-1, 6, 8. This is important pro-inflammatory cytokines. The early alkylonic acid metabolizes the forefront of prostacyclin, thromboxane, and leukotriene. The other inflammatory mediators, such as tissue damaged after activation of the complement, coagulation factors, bradykinin, and fibrinolytic system. The control and out of control will happen in the host. The regulation is self-limiting of inflammatory cell activation, and activation of inflammatory cells rapidly inactivated. Glucocorticoid has a strong anti-inflammatory effect. On the other hand, it's out of control. The detailed mechanism is not clear. It is generally related to the continuing law of inflammation, induced factors, and inflammatory cell sensitized. Pro-inflammatory and anti-inflammatory response in action. So first we talk about pro-inflammatory dominant. If the pro-inflammatory dominant, it will cause SIRS reaction. And its anti-inflammatory response dominant, it will cause the CARS. That means the compensatory anti-inflammatory response syndrome. The limited inflammation protecting the body from inflammatory injury. This may be benefit for the host, but it also can cause immunosuppression. The body will susceptible to the infection, which will cause the infection become severe. So then we come to the surgical infection. So what means a surgical infection? The definition of the surgical infection means the infection required operative intervention, including that complicated from trauma, operation, and burns, etc. And also caused by the invasion, resident, and the proliferation of pathogens, such as bacteria, virus, and fungi, etc. The classification of the surgical infection according to the pathogenesis can either non-specific infection or specific infection. So non-specific infection, it means suppurative infection. So the common presentation of non-specific infection included the redness, swelling, halt, oiliness, or dysfunction of the organ. And the pathogens of non-specific infection may be Staphylococcus aureus or Streptococcus. And the other infections, for example, the tuberculosis, tetanus, gas gangrenes, and fungi infections. This means the specific infection. When certain bacteria or the pathogens cause one disease, this means specific infection. And this abscess is caused by Staphylococcus. And this is also the infection of the skin, because this woman have the diabetes, and we do remove the necrosed skin. So this is also another kind of surgical infection. And the surgical infection classification according to procession, it can be divided into 3 groups. One is an acute surgical infection, and another is subacute surgical infection. Another is chronic surgical infection. So acute surgical infection means less than 3 weeks, and subacute between 3 to 8 weeks. The chronic more than 8 weeks. And the classification according to the source of pathogens, it can be the primary. The primary means the pathogenic microorganism invade the host infected for the first time, and the secondary means another of pathogens infection phenomenon occurred in an already infected host, and also it may be exogenous or endogenous. And according to the opportunities of infection, it can be the opportunistic infection. That means an infection caused by an organism which become pathogenic under certain conditions, example, during immunosuppression, and also maybe sugar infection. It means a frequent complication of drug therapy for microbial infection. It may result from opportunistic colonization following immunosuppression by the primary pathogen, and it can be influenced by the time interval between infections, microbial physiology, or host resistance. And another is also communal infection. This means any infection which a patient contacts in a healthcare institution. The etiology of surgical infection, maybe dependent 2 parts. One is the pathogen, another is for the host. The strength of the pathogens is very strong, and the host resistance is low, and this may be cause the surgical infection. For the bacteria, because the surgical infection may be caused by the bacteria or the fungi or the protons. For the bacterial factors, the adherents or toxins, either exotoxin or endotoxin, and the number of bacteria is also very important for the etiology. It's more than 10 plus 5. The number of bacteria should be more than. And also the local factors for the host. If the skin or the mucosa was injured, or the duct was obstruction, or the organ, the blood supply is decreased, and also maybe the patient has the skin and the mucosa disease. And if the patient has some systemic factors, such as severe diseases, the use of hormone, or the patient is malnutrition, or this patient AIDS patient, these are systemic factors for surgical infection. The pathology of the surgical infection can be divided into 2. One is non-specific infection, and another is specific infection. The non-specific infection of pathology, one is for the bacterial proliferation, leukocyte infiltration, inflammatory media, and cytokines release, and the congestion, exudation, also the accumulation of serum, blood cells, necrotic tissues. So the clinical manifestation maybe is the redness, the swelling, the hot and the soreness, and also maybe cause the organ dysfunction. And the result of the non-specific infection may be elevated, and for the severe patient may be spread or suppurative, and in some cases may be chronic. For the specific infection, the pathology may depend on the different pathogens. It will cause tuberculosis, or the tetanus, or the gas gangrenes, and also the fungi infection. And the diagnosis of the surgical infection depend on the clinical presentation and the investigations. And the clinical presentations include the systemic conditions, local conditions, organic systemic dysfunctions, and specific expressions. And for the investigations, maybe depend to one is experimental test, for example, the blood routine test. And for the imagings, we usually use ultrasound, X-ray, CT scan, and MRI. And for the management of the surgical infection, we depend on first for the local treatment, where you protect the infection site and the superficial lesions to treatment the superficial lesions, and for the deeper lesions, we also maybe use the skin CT scan and B ultrasound, find the deep lesions and do the drainage. For the antibiotic used, and this is according to the different kind of pathogens involved. So the different antibiotics should be used. We also should improve the systemic conditions of the patient. Maybe some patients have the imbalance of water and electrolyte imbalance. So in this patient, the hydroelectrolyte balance should be maintained. And for malnutrition patient, and we should give him the nutrition, and also should accompany the companion diseases should be treated. And infections that require operative treatment include necrotizing soft tissue infection, the body cavity infection, confined tissue, organ and joint infection, prosthetic device associated infections. And the infections that result from operative treatment include: one is wound infection, and second is post-operative abscess. The third is post-operative peritonitis. The fourth is post-operative body cavity infections. The fifth is hospital-acquired infection, result from the transmission of pathogens from a source in the hospital environment to a previously uninfected patients, such as pneumonias, urinary tract infection. The diagnosis of surgical infection should be according to clinical examination and laboratory examination. The clinical examination, also the clinical manifestations, include the systemic symptoms for fever and chills, elevated pulse rate, and also the endemic signs and symptoms. It means the redness, swelling, heat, pain, and loss of function. And also in some severe patients, it may have the shock and the dysfunction of organs. In the laboratory examination, firstly, in the blood routine examination, we will find the elevated white cell counting. The WB white cell counting may more than 10,000 per milliliter, and also we have found immature granulocytes more than 85%. The second is the exudate examination. The exudate from the wound site should be examined by macro and micro method, and also the physical natures of the exudate should be examined carefully. The color, the odor, and the consistency. And the blood culture, it is the single most definitive method of determining etiology. That means which kind of pathogen was infected in the host. The laboratory should be requested to do aerobic and anaerobic cultures and antibiotic sensitivity test. For the treatment, the principle of therapy is to inhibit the bacterial proliferation and promote body tissue recurrence. The patient's own host defenses and antibiotic therapy are adequate to overcome most infections. For the endemic treatment, it should be in immobilization of infected area and have a rest, or give the medication to the patient, and the physical therapy, or most patients should receive operation. For the operative treatment include the incision and the drainage, the abscess. The infected wound should be opened, and the infected foreign body should be removed and repair and divert a bowel leak if the patient has a bowel leakage, and draining an intra-abdominal abscess is also very important for the operative treatment. And for the systemic treatment, it applies for severe infection, especially systemic infection. The methods include support treatment and the use of antibiotics. There's different types of surgical infections. The one is soft tissue infection. That means the infection of soft tissue, skin, subcutaneous fat, tissue, and muscle. It usually can be treated by antibiotics unless an abscess is present or tissue necrosis is present. And the cellulitis is also called phlegmos. The cellulitis is a spreading infection of the skin and the subcutaneous tissue. The characteristic of cellulitis, it is a local pain and tenderness, edema, and erythema. Usually, the border between infective and uninvolved skin is indistinct. So, this is when the sample of the cellulitis in the leg, and this is very severe cellulitis in the neck. So the cellulitis can be treated by antibiotics alone. Local care includes immobilization and elevation to reduce pain and swelling. Failure to achieve prompt clinical response should suggest that suppuration has occurred and that surgical drainage is required. Erysipelas. It means an acute spreading cellulitis and lymphangitis, usually caused by hemolytic streptococcus, which gain entrance through a break in the skin. It is characteristic by the abrupt onset, chills, fever, and prostration. The skin in erysipelas patient is red and swollen and tender, and there is also a distinct line. So this is the patient of the erysipelas, and this too also the erysipelas patients. And this is the angioinfarctitis patient. And for the abscess, that means localized collection of pus surrounded by an area of inflamed tissue in which hyperemia and infiltration of leukocytosis marked it. So this is the abscess in the